Hi there, welcome to the Sports Med Minute, a conversation with healthcare professionals across Northern Michigan, brought to you by Northern Michigan Sports Medicine Center. My name is Jeff Saman, I'm a physical therapist at Sports Medicine, and today I'm talking with Dr. Todd Sheperd. Dr. Sheperd, thanks for taking the time to speak with us today.
Thank you.
Could you tell us about your practice and your specialty?
I am a family physician, and I'm also board certified in sports medicine. About half of my practice as an outpatient relates to sports medicine injuries, and the remainder of it is sort of the bread and butter primary care.
Okay, great. So you do kind of people from really young kids to older people, kind of everybody in between?
Yep. And most of my sports medicine is related to organized athletes, both through the high school, middle school, but also the sort of weekend warrior, as you say.
Mm-hmm.
So unorganized, maybe older people that are just keeping fit and active for enjoyment.
Great. So we're kind of getting into golf season. I'm sure people are ready to get out and start hitting the links. I'm sure you see a lot of golf injuries in your practice. What are some of the most common types of injuries?
Well, they run the gamut, but certainly as summer's getting closer, we start to see a little more active referrals and consults related to injuries. But specifically, we see back, I would say, has got to be probably number one.
Okay.
But in addition to that, we see a lot of shoulder, elbow, and even wrist injuries.
Okay, so let's kind of divide them up a little bit. Let's take the ones that happen in the arm. If somebody has a shoulder or shoulder or an elbow problem when they're golfing, where does that typically show up? Where do they feel problems?
Well, typically, a lot of times actually, it's sort of the lead shoulder that seems to be injured an awful lot with golfers, especially. And traditionally, sort of rotator cuff, you've heard a lot about that, I'm sure.
Mm-hmm.
Very common injury with golfers, and some wear and tear arthritis can also kind of show up in the shoulder as well. Typically, it's usually, when I see patients with shoulder pain, it's usually sort of the outside, can also be in the front, but occasionally they also have directly over the top of the shoulder. Some people, even with shoulder injuries, will feel the pain down even into their arm a bit.
Mm-hmm. So if I'm a right-handed golfer, I'd be feeling that in my left shoulder most commonly.
Most commonly.
Okay.
Yeah.
And then what about in the elbow? What kind of things do you see there?
Well, it's interesting because you probably heard of golfer's elbow and tennis elbow, and in my practice, actually, I see a lot more tennis elbow in golfers.
Oh, is that right?
Golfer's elbow in tennis players.
Is there anything you can attribute that to?
Well, I think whoever named it, maybe they just didn't have quite as much experience, or they had the person they called a tennis elbow was really interested in tennis and didn't see a lot of golfers. But a lot of times, again, it depends on a lot of patients with their technique and their overall level of fitness. Will really kind of help determine where they're going to start to experience pain, especially with golf. We see a lot of overuse injuries as a real prime cause of pain.
Okay.
So typically the golfer's elbow is on the inside of the elbows, and I can see it either in their lead shoulder or their dominant arm shoulder. So if they're a right-handed golfer, you can see it on the inside of the elbow, the right side or the left side. And again, it kind of just depends on their specific body and also their specific swing.
Okay, so let's say that I've been out golfing for a couple weeks. It's the beginning of the season. My left shoulder's hurting a little bit, and the inside of my right elbow's starting to ache a little. What should I do?
Well, it depends on how much it's bothering you. Sort of the things that a lot of people try before they come to see me, which is usually generally safe if it's without significant trauma. Stretching, ice. A lot of people have already tried the ibuprofens or Tylenols. And those are reasonable things to do if it's mild pain.
Mm-hmm.
Obviously, if you have significant trauma or you hit a root or something like that, that may be different, and you may need to seek medical attention before that.
Okay.
But typically, if it's sort of a nagging kind of thing that's sort of just creeping up on you, and if you try the stretching and you try the ice, or even modifying your activity, then it's time to actually talk to somebody about what could be really going on.
Okay, so let's say that I've gone through all that, I've done the acute management, it's still not getting better, I come to see you. What are some things that you might have me do? What might be part of your treatment recommendations?
Well, typically we're going to kind of go from the start of it, what brought it on, how long it's been there, how severe is it, and really try to pinpoint the location and what seems to make it better or worse, or anything else that's associated with it. The history, a lot of the times with a detailed history, you can get a really good sense of what may be going on. And the physical exam really is to help try to prove what may be going on and help us decide either do we need more tests or do we need to do something differently, or can we take something off the list that might be causing the pain. In particular, I know a lot of people will just say expect or talk to me about getting MRIs, and you have to be really careful about that because when you're 40 or 50 years old and you've done a lot of things in your day, there may be some wear and tear and stuff in there that's not causing your pain, and you do an MRI and you see it, but then what do you do about it? If it's not causing the pain, you don't necessarily need to have it fixed or injections or those kinds of things. It's more important to really get a good history and a good physical to help decide what's really causing the pain. And then kind of move forward there based on that.
So it sounds like what you try and do is identify what is the symptom generator, what structure in the body is causing that problem. You don't want to just give it a blanket treatment and say, oh, if this hurts, then you should do this. You want to try and be specific about it and find out exactly what's going on.
Everybody, when they come with a different set of exposures to different environments, whether it's with golf in particular especially, but what do they do in their day-to-day work, other things that contribute to that, all it's part of the formula, and the better information we have at the beginning, the better we're going to have in terms of outcomes at the end.
Okay, so let's say that you've gone through that with me as your patient. You've identified that I've got some tendonitis of one of my rotator cuff muscles, and I've got a little bit of weakness in my forearms that are causing me to turn my arm over differently, that's causing some strain there. What can I do about that? What would you do? Where would you refer to?
Well, typically, again, it really bases, I base it on how much it's bothering you, and if we have a good sense of working diagnoses, typically, the foundation really, and I emphasize this all the time with my patients, is you need to have a good fundamental swing, but you also need to have a good fundamental base of fitness. And one of the things that people in your specialty are very good at is identifying specific areas that can contribute to that. The great example is somebody who doesn't have a good turn with their shoulders during golf, or doesn't have strong core strength. They tend to make up for that, or need to make up for it in other places, and a lot of times that ends up being the shoulder or the wrist or the elbow. And so this may be just a signal to you that you need to work on the rest of your body. Even though your elbow hurts here, it could be just that your core needs to be addressed, in addition to getting rid of the pain generator, which may be a tendon in that case.
And we see that a lot in physical therapy, where I don't even touch somebody's shoulder or elbow the first couple treatments other than symptomatic relief. I tend to focus more on the hips and getting the swing to work together a little bit better, so those small structures aren't getting overstrained.
Right.
Okay.
And I haven't gotten any insurances to pay for yet, but I think hand in hand with therapy goes golf instruction. They need to work together, and you guys help set up the base. You make sure that all the function is there physically, and then making sure that a golf pro can help you execute, I think is the key to keeping healthy and not having re-injuries or chronic problems.
Great. Okay, thanks. We're going to talk a little bit more about back injuries in golf in part 2 of our conversation with Dr. Sheperd, so please tune into that in the next week or two.